Let me start with something that may shock you. You can feel perfectly healthy, walk normally, eat daily meals, laugh with your family, and still be silently moving toward a heart attack, a stroke, or kidney failure without even knowing it. This is the dangerous reality of hypertension. It's often called the silent killer, not because it is rare, but because it quietly damages your body for years before you feel anything at all. And here's the truth most people don't hear. High blood pressure is not just about salt, not just about stress, and not just about aging. There is a deeper, real cause behind it, and until you understand that cause, you're only managing symptoms, not fixing the problem. Today, I want to explain this to you not as a textbook lecture, but as a senior doctor who has seen thousands of patients walk into clinics thinking they are fine and walk out realizing their life is at risk. Let's begin. When your blood pressure is high, it means the force of blood pushing against your artery walls is too strong. Imagine a water pipe in your home. If the pressure is too high, the pipe slowly gets damaged, cracks form, leaks begin, and eventually, something bursts. The same thing happens inside your body. Your arteries become stiff, your heart works harder, your brain becomes vulnerable, and your kidneys slowly lose their ability to filter waste. But here's where most people misunderstand things. They think, my blood pressure is high because I ate salty food, or it runs in my family so nothing can be done. This thinking is incomplete and sometimes dangerous because the real root of high blood pressure often lies deeper in your daily habits, your metabolism, your hormones, and even how your body handles stress and sugar. Let me explain this clearly. One of the biggest hidden drivers of high blood pressure is something called insulin resistance. You may have heard about it in relation to diabetes, but very few people realize how strongly it is connected to blood pressure. When your body becomes resistant to insulin, your blood sugar starts to rise. But at the same time, your body holds on to more sodium and water. This increases the volume of blood inside your vessels, more fluid, more pressure, and slowly your blood pressure rises. Now think about modern lifestyle habits, frequent sugary drinks, processed foods, lack of physical activity. These are not just causing weight gain. They are silently pushing your blood pressure higher every single day. I've seen patients who say, "Doctor, I don't eat much salt," yet their blood pressure is dangerously high. Why? Because sugar and refined carbohydrates are playing a bigger role than they realize. Another hidden cause, chronic stress. When you are under constant stress, financial worries, family pressure, work tension, your body stays in a state of alert. Stress hormones like cortisol and adrenaline remain elevated. Your heart beats faster, your blood vessels tighten. This is useful in short bursts, but when it becomes your daily state, your blood pressure never gets a chance to relax. Your body forgets what calm feels like, and then comes poor sleep. Many people underestimate this, but lack of sleep or disturbed sleep changes your hormones, increases stress levels, and disrupts your body's natural rhythm. Over time, this contributes significantly to high blood pressure. I often ask patients, "How well do you sleep?" And they say, "Doctor, I sleep late, wake up tired, but it's normal." No, it is not normal. It is a warning sign. Your body repairs itself during sleep. Without it, damage accumulates silently. Let's talk about another critical factor, your blood vessels themselves. Healthy blood vessels are flexible. They expand and contract easily. But due to poor diet, smoking, lack of movement, and inflammation, these vessels become stiff. When arteries become stiff, even normal blood flow creates higher pressure. It's like trying to push water through a rigid pipe instead of a flexible one. The result? Rising blood pressure, even if nothing else changes. And then there is weight gain, especially around the abdomen. This type of fat is not just extra weight, it is metabolically active. It releases chemicals that increase inflammation, disturb hormones, and raise blood pressure. This is why two people with the same weight can have very different risks, depending on where the fat is stored. Now here is something very important I want you to understand. High blood pressure does not usually come with loud symptoms. You don't always feel pain. You don't always feel dizzy. In fact, many patients tell me, "Doctor, I feel absolutely fine." And yet, when we measure their blood pressure, it is dangerously high. Sometimes the first sign is not a warning. It is a complication. a sudden stroke, a heart attack, a kidney problem. This is why regular checking is not optional. It is essential. Let me share a simple real-life scenario. A man in his early 40s comes to the clinic for a routine check. No complaints. Active job, feels healthy. We check his blood pressure, it's very high. He is shocked. How is this possible? I feel normal. But inside his body, damage has already started. This is the silent nature of the condition. And this is why ignoring it is one of the biggest mistakes people make. Another mistake is relying only on medication without changing lifestyle. Yes, medicines are important. They save lives. But if you continue the same habits, poor diet, stress, inactivity, you are only controlling numbers, not correcting the root cause. It's like mopping the floor while the tap is still running. You must address the source, and this is where most people fail, not because they don't care, but because they don't understand what truly needs to change. But don't worry, because in the next part, I will show you exactly what you can do, practical, doctor-recommended steps that target the real causes of high blood pressure. Simple changes, powerful results, changes that can not only control your blood pressure, but in many cases, significantly improve your overall health and reduce your long-term risks. So stay with me, because what I'm about to share next could truly change the direction of your health and your life. Now that you understand the real causes behind hypertension, let's talk about what actually works. Not temporary fixes, not myths, but real, medically sound steps that I recommend to my own patients, steps that address the root of the problem. Because here is the truth. Your body has an incredible ability to heal. If you remove what is harming it and support what it truly needs. Let's begin with the most powerful change, your diet. I want you to stop thinking only about reducing salt. Yes, salt matters, but it is not the whole story. The bigger issue today is processed food and hidden sugars. When you regularly consume sugary drinks, white bread, bakery items, packaged snacks, your insulin levels stay high. And as I explained earlier, high insulin leads to fluid retention and increased blood pressure. So one of the most effective steps you can take is this. Start reducing sugar and refined carbohydrates. Shift your meals toward natural, whole foods. Vegetables, fruits, lentils, nuts, healthy fats, and clean protein sources. When you do this, something remarkable happens inside your body. Your insulin levels begin to stabilize. Inflammation reduces. Your blood vessels relax, and your blood pressure naturally starts coming down. I have seen patients reduce their readings significantly within weeks, just by cleaning up their diet. Now let's talk about movement. Your body was not designed to sit all day. When you remain inactive, your circulation slows down, your arteries become stiff, and your heart has to work harder. But when you move, walk, stretch, climb stairs, you activate your entire cardiovascular system. Even a simple 30-minute walk daily can make a powerful difference. It improves blood flow, reduces stress hormones, helps with weight control, and increases the flexibility of your blood vessels. You don't need a gym. You need consistency. Now let's address something that is often ignored, but incredibly important: stress management. Remember what we discussed earlier. Chronic stress keeps your body in a constant fight-or-flight mode, so the solution is not just physical, it is mental and emotional as well. You must create moments of calm in your day. Deep breathing, quiet time, prayer, meditation, even sitting peacefully without your phone. These are not luxuries. They are medicine for your nervous system. When your mind relaxes, your blood vessels relax, and your blood pressure follows. Now, let me talk about sleep, because this is where many people unknowingly damage their health. If you are sleeping late, waking up tired, or constantly interrupted during the night, your body never fully recovers. Hormones remain imbalanced, stress increases, blood pressure rises. Aim for 7 to 8 hours of deep, restful sleep. Try to maintain a regular sleep schedule. Reduce screen time before bed. Keep your environment calm and dark. You will be surprised how much this alone can improve your health. Next comes weight, especially abdominal fat. You don't need extreme dieting. You don't need to starve yourself. But even a small reduction in weight, just 5 to 10% of your body weight, can significantly lower blood pressure. Why? Because it reduces the strain on your heart, improves insulin sensitivity, and decreases inflammation in your body. This is a powerful medical fact, not a theory. Now I want to speak about something very important: medication. If your doctor has prescribed blood pressure medicine, please do not stop it on your own. Medicines play a critical role in protecting your heart, brain, and kidneys, especially when blood pressure is very high. However, medication works best when combined with lifestyle changes. Think of it as a partnership. The medicine supports your body, while your habits heal it. Over time, many patients are able to reduce their medication under proper medical supervision because their body becomes healthier. But this only happens when you take action. Now let me give you a simple daily framework, something practical you can start immediately. Wake up and hydrate your body. Move your body every day, even if it's just walking. Eat real food, not packaged food. Take moments to calm your mind. Prioritize your sleep like your life depends on it, because it does. And most importantly, monitor your blood pressure regularly. Don't guess, measure, because awareness is the first step toward control. Let me leave you with something I tell all my patients. High blood pressure is not your enemy. It is a signal that your body needs attention, care, and change. If you ignore it, it will harm you silently. But if you listen to it, understand it, and respond wisely, it can become the turning point that saves your life. You don't need perfection. You need consistency. Small changes, done daily, create powerful results over time. Your heart is working for you every second of your life. Isn't it time you started working for it? Take care of your body, protect your health, and make choices today that your future self will thank you for. Because in the end, the greatest wealth you will ever have is your health.